So I'm Dr. Catty Bakai. I'm one of the GP partners at Bromley by Bow Health. We look after about of the Tower Hamlets population between our 3 sites and our sister site, and we work very, very closely with the Bromley by Bow Centre as well. Kerry is our GP trainee, so she has been a qualified doctor for several years and is training to work as a GP and has essentially completed all those hurdles and is finishing her training and officially becoming a GP in March, April time. And we're both here to give you some information in a sort of more less formal way, and hopefully in a way that allows you to ask the questions that you might not be able to ask in a GP consultation. But yeah, it's just in a more informal way, really. So looking forward to lots and lots of questions from the team. We've got about 10 or 15 minutes of information that we think will be helpful, and then we're going to leave the rest for question and answer time.
Okay, thanks, Catty. So can everyone see the screen now? Is it sharing okay? Yeah. So as Catty said, we're going to run through some of the background around COVID and the current situation, and then we're going to answer your questions. Just a quick caveat that obviously the information is changing really rapidly as the situation evolves. So just to reassure you, all of this information is correct as of today, but it's really important to keep up to date with everything as things do change. So just a bit about the current situation. So as you know, in the last couple of days, we've had the news that we've now passed more than 100,000 deaths in the UK from COVID-19, and that's since the start of the pandemic. And actually 12,000 of those have been in London, so around 10%. And we know that there's been a higher proportion of cases and deaths in Black and minority ethnic populations as well. And this graph is just sort of illustrating that our rate in the local area in Bromley by Bow and Tower Hamlets is above average compared with the rest of England. So we are living in a very high risk area at the moment. Cases are very high. There is some evidence that they're starting to come down, but we need to remain really sort of aware and following the guidance because of that. And this is having a big impact on our hospitals as well. So the data from Barts Health shows that in Tower Hamlets, we've got more than 800 people in hospital because of COVID-19, and 177 of them are on ventilators, so very seriously unwell and needing help to breathe. So the situation is very severe, and I just wanted to sort of put that in as a background so that we know why everything we're about to say is so important.
I'll start with a bit of myth busting now, actually. So one of the questions that we often get asked, Kerry, you'll have heard this, is COVID the same as flu? And Kerry's kind of slide just depicts that it is so much more severe than flu. We never see this many people in hospital and this many people on ventilators, and this many deaths from flu every year. So in the period that 100,000 have died from COVID, we would see maybe about 1/5 of those every year for flu. So COVID is so much more severe than a normal flu infection.
So because of all of this, we are now in a national lockdown. The rules are the same throughout the whole country, and this is just a reminder about what that means. So this is currently law. So you must not leave home or be outside of your home apart from very specific reasons. So you can shop for groceries, for food and for any essential items, and you can do that for yourself or you can do that on behalf of a vulnerable person as well. Most people are being asked to work from home, but if you can't, you are allowed to leave home to go to work or provide voluntary or charitable services. You are allowed out for exercise, which should be once a day and should be in your local area, so not travelling. And you can do that either alone or with your household, or you can meet one other person, but you must remain 2 meters apart at all times. And I think that's quite important because we know that mental health is having an impact during COVID as well. And I think it is important for people to get outside and exercise when they can, but within the rules and in a safe manner. So it's really important to know. Some people are able to form support bubbles or childcare bubbles, and that is essentially if you live alone as a single adult, or if you are one adult in a household with just children, you can form a support bubble with another household. And you can form those for childcare reasons as well, but it must be between those two households only. You can't change it, and you essentially then are treated as one household. So all the rules that would apply to do with isolation for that household then apply to the bubble. Again, that's a really good opportunity if you're living on your own or need support, to sort of support your mental health as well and have that social interaction in a safe way. You can of course leave home to seek medical assistance, and that includes coming to doctor's appointments, coming for your COVID vaccination if you have an appointment for one, coming for your flu jab, and if you feel unsafe at home, so if you are at risk of harm, including domestic abuse. And again, we know that rates of domestic abuse are rising, and we want people to know that you can leave home to keep yourself safe and you will not be penalised for that at all. Of course, most schools are closed, but certain children can still attend. So children of key workers, for example, and lots of nurseries are open, and you can leave home to take your children to school as well. So essentially asking people to stay home as much as they can and only leaving home for those basic reasons. And that is to stop the spread within our community. So if you are leaving home, or if you're at home, we thought we'd talk a little bit about how to stay safe. So the main messages we have so far are to wear a mask, and that's particularly important if you're using public transport or if you're going into a supermarket or a crowded area, to wear your mask, to wash your hands as often as you can, so any time that they may have been contaminated by touching something when you're out of the house, and just at regular intervals throughout the day, and keeping a safe distance from everybody else who's not in your household, so 2 meters away, wherever possible. And Katty's going to tell you a little bit more about how you can keep yourself safe in the community.
Yeah, brilliant. So, I mean, this is a completely serious matter, COVID, but just a little bit of a joke. But how many people have seen people wearing masks like this, and the new fashion like this as well? I'm sure we all have. And this, I mean, I'm joking a little bit, but it's so important that we get this right. The majority of people in the community are wearing either disposable masks like this, I hope you can see mine, like you see in the doctor's surgery, or masks with cloth, like cloth masks. Both are fine, but these are much safer. These are safer because they contain 3 different layers inside, and there is a waterproof layer as well. So not only do these masks protect other people, but they protect you. The cloth masks are a reasonable alternative, but we recommend that if anyone has any long-term condition or that makes them more vulnerable to coronavirus and the effects of coronavirus, that they get these sorts of masks, which are now available relatively cheaply. And in the beginning of the pandemic, they'd all gone, but now we can buy them a lot more readily as well. So the thing I want to tell you about the masks, if you're wearing something like this, or if you're wearing a cloth mask, make sure that you use it by using the string. So I'm going to demonstrate how you put it on. You don't touch all this bit of the mask because you're contaminating it. So before you put it on, you wash your hands. When you use the masks, use the string, make sure you put it on. And when you use this sort of mask, there are 2 sides to it. There's the top side, which is a bit more stiff, and the bottom side, which isn't stiff at all. So the stiff side goes over your nose. And then make sure that you actually pinch it so that it forms a really nice tight layer around your nose. Now, if you're like Jess and wear glasses, I've been told, like my mum tells me that they just keep steaming up when you wear stuff like this. But actually, if you put a really good pinch around your nose, the air doesn't keep going up into your glasses, and it will stop them steaming as well. If you only wear it around your mouth, which is what I see lots of people do, it is not protecting you. It is not protecting other people. So doing this does nothing. Make sure that it's over your nose as well. Make sure it's pinched tightly. Make sure that you use your string to take it on and off. If you are using these sorts of masks, then they are disposable ones. So they need to be changed at least once daily. If they become soiled, if they become wet, if they rip, they need to be changed more frequently than that. If you are taking them off in the day, then don't take them off and then leave them on a desk or on a top somewhere. Keep a little plastic, a clean plastic bag with you, which they go into, so that you can take them out and use them again if they're not contaminated. And just get into the habit that every time you're taking them on and off, that actually you're washing your hands, because that way you're keeping it nice and sterile. If your hands are dirty and then you start touching the mask, it becomes contaminated essentially. So that's, if anyone has any questions about the mask, put them in the chat now. With cloth masks, please wash them at least once daily as well, just for adequate protection. And it goes without saying, but please don't share your mask with other people, because that in itself puts others at risk. So masks are really, really important at the moment. Even with masks, we recommend that you keep at least 1 meter distance. So the big government signs everywhere says hands, face, space. The best way to actually keep yourself safe is to make sure that you wash your hands for at least 20 seconds. At least 20 seconds gets rid of a lot of the majority of kind of any contamination within your hands. Any less time than that, and you've still got 80%, 90% cleanliness, but 10-20% is still there. So wash your hands for 20 seconds. Make sure they're not just washed like this, but you're going between the fingers, around your thumb, backs as well. So your hands are really nicely, thoroughly cleaned. That you keep alcohol gel on you if you're unable to unable to wash your hands for whatever reason. And the distance thing, so hands, face, we've talked about, and space. The space issue comes from how coronavirus is transmitted. So coronavirus is largely transmitted in infected kind of spit particles, so very, very small bits of spit that when we talk or when we sneeze, they go into the air. We can't see them in majority of cases, but they go into the air. So if I were to sneeze or cough, my spit particle, if I had coronavirus, it would be infected and it would travel. It could travel for up to 2 meters. Okay, so that's why we say keep at least a 2 meter distance. And with a mask, it's still recommended you keep at least 1 meter distance from people outside your household. So when you are speaking, when you are sneezing, the spit particles go into the air and they drop somewhere. And then if that happens to be where Kerry is sitting or working, she could potentially, that spit particle could potentially contaminate her area. She's then touched that area with her hands and starts touching her face or eating or, you know, wiping things, that infection then goes inside her body. So it's really the hand washing prevents all of that, the distance prevents all of that, and of course the mask prevents all of that. And in combination, that strategy works really well. Okay, is that all right? Hopefully that if anyone has any more questions, just pop them in the chat and we'll clarify.
So yeah, really important, hands, face and space to try and keep yourself safe if you are going out in the community. So we just thought we'd give you a refresher about what the symptoms are of COVID-19, because people are often still uncertain, feel that the symptoms can be a bit vague. Is it the flu? Is it a cold? Is it COVID? So the 4 main things you need to look out for are a high temperature, a new cough, a loss of smell and a loss of taste. Now they can be mild, so your child could have a one-off high temperature, you give them some Calpol and it comes down again. You must still think about whether this could be COVID and get a test. Similarly, the loss of smell, loss of taste could be quite subtle, but if you have noticed a change, it's really important that you go and get yourself tested, because we know lots of people with COVID have very mild symptoms, but they are still at risk of passing it on to people who are more vulnerable and more likely to become unwell. There are other symptoms that people experience when they have COVID, so some people will have diarrhea and vomiting. Some people might feel a bit fluey, a bit achy, but these are the 4 main ones. And if you have any one of these 4, however mild it is, you must get yourself tested and follow the guidance. So and we'll talk a little bit more about what to do if you do have any of these symptoms, but those are the four main ones. You don't necessarily need a thermometer to check your temperature, but if you feel feverish or feel warm, or your child feels warm to touch, then you could consider it. Consider whether you have COVID. It is useful to have a thermometer at home so that you can keep an eye if you're not sure and you're looking for any temperature above 37.8. So if you have any of those symptoms, or you think you may have any of those symptoms, the first most important thing is that you and everybody in your household or support bubble must isolate. So you all have to stay at home from the moment that any one of you develops any symptoms. Do not wait for a test result, don't wait for confirmation, don't wait to see if it gets worse. Isolate and confirm it at that time. And that's because we know that people can be carrying it and be infectious to other people before they even start to display symptoms. So it's really important that as soon as you suspect anyone in the household has COVID, you all isolate and reduce the risk of spreading it. So anyone with symptoms should get a test. And I'm often asked about children. Can children have a test? Yes, children can have a test. All ages are able to have a test. An adult will have to perform the test for a child, but it's quite straightforward. The recommendation is that you get the test done within 8 days of your symptoms starting. I would say get it done, get it ordered as soon as your symptoms start, even if they're mild, because the sooner you can confirm it's not COVID and de-isolate, or the sooner you can confirm it is and we can track everyone you've been in contact with and stop the spread, the better. It's also more likely to be a true result if you get it done earlier, so you can get false negative results if you get it done later. So as soon as you start suspecting symptoms or your child has symptoms, please stay at home and order a test. You can order the test online, so I've put the website here and it will take you through step by step all the details to do with the symptomatic person and anyone else in the household who might need a test. Or if you're struggling with the online form, you can call 119 and they can help to organise it for you. It is free, so we know that whenever things like this happen, there will always be scams and people asking you to pay for tests. If you have symptoms, you can have a COVID test for free. You won't be asked for your card details or to pay any money. So that's really important, just be aware for that. And the test can be done at home, or you can book a slot at a walk-in or drive-through site. The home kits are normally delivered within about 2 days, and then they need to be picked up and posted back. So it's a bit of a slower turnaround to get your test result with a home kit, but you can go to a walk-in or drive-through site. There are some where you can turn up, but most need a pre-booked slot, and you are allowed to leave your home to go for a COVID test, but we would advise you not to use public transport because you're putting other people at risk. And then you must all continue to isolate, and if your test is positive, you'll be asked to isolate for 10 days from the onset of your symptoms, and everyone in the household to do that as well. If it's negative and everybody with symptoms is negative, then you can stop isolating. But it's really important that you all continue to isolate until you've got that negative result. Even if you start to feel better and think it's not COVID, you need to continue to isolate until you test negative or until you've completed your 10 days of isolation. And that means not leaving the house for any reason unless it's an emergency. I'll just mention as well that there are some rapid testing sites that have opened in Tower Hamlets. So there's one in Mile End at the Pavilion Centre, and there is another one that's opened as well that's pre-bookable in Poplar. These are rapid tests for people without symptoms, and it's advised that anyone who is a key worker or who cannot work from home and so is still needing to leave the house frequently should get themselves tested a couple of times a week or every week, just because, as I've said, we know that people can have COVID and not have symptoms and still be transmitting it. So the one at the Ecology Pavilion in Mile End is open, I think, 10 till 7, and you don't need an appointment, you can just turn up. The other one in Poplar, I will get the address for, but it's a pre-bookable one. But we'd encourage people to have them done, because then we know if you haven't got any symptoms but you test positive, you can isolate, your household can isolate, and we can stop you from spreading that to other people. So that's an important thing to mention as well. So if you have your test, you're isolating, but you have confirmed COVID-19, obviously it's not just about isolating. We need to think about whether you're unwell or whether you need any extra help. So the first thing to say is that we are open. Your GP surgery is open. Lots of us are doing things on the phone, first of all, but we will see you if we need to see you. And you can get through to us either on the phone or by e-consult. Some people find that easier. And if it's out of hours or you can't get through to your GP, you can call 111 if you're worried about your symptoms. So most people with COVID will have mild symptoms, can look after themselves at home. But if you are breathless, if you have severe muscle aches, if you're shaking, shivering, or you're feeling unwell, or you're worried about your symptoms, then we would encourage you to call either your GP or 111 to get some advice. And I think you should be particularly aware of that if you've got any other health conditions that make you more vulnerable to COVID, or if you take any other medications, just have a lower threshold for picking up the phone to come and speak to us, because you may be more at risk of developing severe disease and we may need to provide support. Like I said, we will see you if we need to see you, or we can provide support on the phone. We can also provide oxygen home monitoring so that we can keep a close eye on you for any signs that you're becoming more unwell. So please do call us if you're worried. Of course, if you're very unwell, if you are unable to speak in short sentences, if you have chest pain, if you feel very dizzy or collapse, that's an emergency and you need to call 999 or get yourself to A&E because you may need more support. And I think it's important that people aren't afraid to attend A&E or call 999 if they're that unwell, because they are still open, they can still treat you, and we don't want people to be at home becoming more and more unwell and feeling afraid to call. Having said that, the vast majority of people with COVID-19 will have mild symptoms and can stay home and look after themselves. And Kathy's going to talk a bit more about how you can look after yourself and manage your symptoms if you're at home with COVID.
Thank you. Brilliant. So the main kind of points from what Kerry is saying, if you have symptoms, no matter how mild, just get yourself tested. We're at such a state of emergency in Tower Hamlets at the moment that we're opening sites where you can actually go even if you don't have symptoms. Because I've been reading in the chat, people are saying, you know, my daughter didn't have any symptoms, and we know that a small proportion of people with coronavirus infections don't have symptoms, and this is how things are being spread. So actually, if you think that your sense of smell has just gone, and that's often the only symptom we see with young people, get yourself tested. One of the jokes in in general practice that we make very jokes in GP, but there are some jokes, and one of the most common one during coronavirus is patients calling us saying, "I've got a cough, doctor, but it's not COVID." And I'm thinking of, you know, we're thinking, well, I've been studying for about 10, 20 years at university, becoming a doctor, and I can't tell you without the test whether you've got COVID or not. So how is it possible for you to, you know without doing the test that you've got coronavirus or not? So please, please, please don't take your symptoms seriously. And we're still seeing people who've got a new cough, who call us for antibiotics, but have not got the test. So encourage anyone with these symptoms to get a test. Now, in general practice, we look after about 90% of all of the health needs of the NHS. Okay, so 90% of all consultations in the country happen in general practice. In the same way, about 80% of everyone who will have coronavirus, 80% of those will be managed in the community, and only about 20% will need to go to hospital. Of that 80% that need to be managed in the community, a lot of them you can manage yourself, and some people you will need to call us in the GP to help manage you, and not only to help manage you, but to make sure that you're safe to be managed at home, in the community, and monitor you closely to know that actually if you do need to go to hospital, that we give you that advice in a timely way. So the things that you can do to help us and to help yourself is having some equipment at home. Okay, Kerry's mentioned a thermometer. Now, thermometer is such a basic thing, and it will help you not just in coronavirus times, but throughout life. And the great thing about a thermometer is that by touching someone, you can see whether they're feverish or not, but the thermometer tells you whether the fever is going up or whether it's coming down. And the important thing here is people will get a fever with coronavirus. If they can manage it by using paracetamol or ibuprofen, if you can take it, then do that. You can use those medicines safely. There was a concern about using ibuprofen early on in the pandemic, but all of that has been looked at, and it's safe to do it. So if the fever isn't coming down, or if you're getting body aches, you can take paracetamol, and if you can tolerate ibuprofen, you can take that as well. So managing the fever is great, but if your fever persists beyond 5 days, so if it continues longer than 5 days, or despite taking the medicine, it's not coming down and you're feeling quite unwell with it, that's the time to call us. And we will be able to monitor, we'll be able to advise you based on your thermometer readings, whether we need to treat you for something else, investigate you for something else, or give you some other medicine. With other equipment at home, particularly if you've got someone elderly at home, or you're an older person, or if you have any long-term conditions like heart disease, diabetes, kidney problems, if you have any of those things, having a blood pressure machine at home is incredibly useful. Now, not only will it help you monitor your long-term condition, where we need to make sure your blood pressure doesn't go too high. In coronavirus, we worry about those patients whose blood pressure actually drops down. And the worry is that if your blood pressure drops down and your heart rate goes up, those are signs that you might be better suited to being looked after in the hospital. Okay, so if you have a blood pressure machine at home already, and you can take those readings for us, we can guide you over the phone better around what to do and how to manage your symptoms. And of course, outside of coronavirus, you can use that machine to monitor your long-term condition to make sure your blood pressure is in a good range for you. So thermometer and blood pressure machine. Hopefully you'll have seen both of those things. And from thermometer, I've just remembered, lots of people in their sort of bottom drawer still have those old mercury thermometers, particularly used in India when I was growing up as well. They're not safe. Mercury can snap, break, and if you consume it, it's not safe. So get rid of the old mercury thermometers safely, and get one of the sort of plastic ones that you can either put in your mouth, or the ones that you can put in your ears. Now this machine, I don't know, Kerry, can you unscreen share for a second? I don't know if lots of people have seen this machine. This is called a pulse oximeter. Okay, and again, this is something that's around £20, 15, 20, £30 online on Amazon, other shops, Boots, and so on. And it gives you two numbers on there. It just goes on my finger like this, and it gives you two numbers on there. It takes a little while to pick up your reading. And the two numbers are, one is your oxygen level, and the other is your heart rate. And we know that with coronavirus, what the problem is that this coronavirus affects your lungs and affects your oxygen levels. And that's the bit that's most fatal people, and that's why they often end up on ventilators, or that's why they need to go to hospital for oxygen. So what this does, if you look, it tells you at the moment my oxygen levels are 99. My heart rate is ridiculously high at the moment. I must be very nervous talking to you all, but my oxygen levels are at 99%. So that's a good level for me. In coronavirus, if we see that 99% drop down to below 95%, we worry. We worry about possibly you needing additional oxygen. So having this machine is really helpful for us to monitor you again. So we know that some people will be breathless. Now, even if your oxygen level shows 99, but you're very breathless, we may still send you to hospital. But there are a small number of people who sit around happily with an oxygen level going down to 85, 86, 87, 88 with coronavirus. And we worry about those. And those patients are better served being monitored in hospital actually. So this is how this machine help works, and the heart rate is really important as well, which I've mentioned, that if your heart rate goes very high, then that can also put a strain on your heart as well, and gives us an indication that we might need to monitor you more closely. So this is called a pulse oximeter, a blood pressure machine and thermometer. I think someone's put in there, can you provide links to the machines, and we can do that. There's some reliable sources and companies that do it so that they work properly. Okay, back to you, Kerry.
Thank you. Okay, so that's how you can look after yourself at home and when to call for help. Oops. Why is it not going? That's it. So another aspect of needing to isolate at home, or just of the pandemic in general, is that lots of people are struggling either financially or struggling to get food and medicines because they've been asked to isolate from home. Now, lots of people have friends and relatives who are able to go and get their food for them or pick up medicines from a pharmacy who they've not been in contact with, so aren't isolating. And where you can do that, that's really helpful. But we know that other people find it more of a struggle. And with the cases rising and so many people isolating, it can be really difficult. So we talked at the beginning about our social prescribing team, who are really fantastic, and they're here to help. And I think Nazim has put a link in the chat to them, and you can refer yourself, or you can contact us at your GP and we can direct you to social prescribing as well. And they've been doing a really good job during the pandemic of supporting people who are at home with food, with medicine, with links to financial support, and with any other help that you might need. So their contact details are also on my screen in the bottom corner there as well. There is also the NHS volunteer responders that was set up at the beginning of the pandemic, and that was a group of volunteers who again can assist people with getting food and medicines, maybe not because they're isolating with COVID, but because they were shielding, because they're very vulnerable or finding it difficult to get out. And again, their website is there on the screen, so that's another option if you're struggling. Our social prescribing team have also produced a really good COVID information pack. I don't have one here with me actually, but it's a booklet that's got lots of answers to questions about COVID, lots of information, and it is available from your GP, or I'm told tomorrow it will be available on the Bromley by Bow Health Partnership website. So I'd recommend downloading that because it's full of really useful information and resources. So this is about sort of getting support for your non-medical problems during COVID while you're isolating or struggling. Please reach out to these organisations, because they've been really good at supporting people and making your isolation period that little bit easier. We know lots of people are finding it tough. So just before we move on to taking questions, just a sort of run through about vaccinations. So as you know, at the moment, there are 3 vaccines which have been approved in the UK. We are currently giving 2 of them, the Pfizer vaccine and the AstraZeneca, and the Moderna one will be starting hopefully within the next couple of months. The aim of giving the vaccine is to prevent people from developing severe disease. So as we talked about, those people that need to go into hospital and have support from a ventilator, or need extra care in hospital, we want to protect people from having severe disease. And that is why it is being rolled out in order of the most vulnerable people. So those people who are elderly or have underlying healthcare conditions, or people who are at risk of catching it because they're healthcare workers working in hospitals or coming into contact with COVID cases a lot. So all of the vaccines require 2 doses, and they're being given between 6 and 12 weeks apart. And it's really important because we don't yet know whether this vaccine stops you from spreading the virus, that even if you've had both of your doses and you've got your full protection from it, that you continue to follow all of the guidance around hands, face and space and isolation, because we don't yet know whether you can still spread it to other people. I know that there are a lot of concerns about how quickly the vaccines have been developed. What I would say is that they've all been thoroughly tested and approved by the Medicines Health Regulation Authority. And so that means they've gone through the same testing that any medication or vaccine that we use in the UK will have gone through. So they've had lots of rigorous testing and safety testing so that we can be confident that they are safe to use. The reason that they've been able to be developed so quickly is because all of the resources and funding during the pandemic have been sort of channeled into developing the vaccines because it's so important, and that's allowed more sort of focus on it. And it's also used sort of existing research that has been being developed for other things. They've been able to pick that up and move it to developing a COVID vaccine, so it's really sped things up. There's lots of concerns, and I've seen people asking in the chat as well about whether the vaccines contain animal products or any products from fetal cell lines. None of them do. The ingredients lists are widely available and none of the vaccines contain them. And they have been approved by both the British Islamic Medical Association and the British Muslim Council have both released statements saying that they approve of the use of COVID vaccines in the groups that are being vaccinated currently.
They're completely vegetarian, they're egg free, they're free of animal products, they're free of any fetal products. They basically haven't got anything in them in terms of ethical issues that we're talking about that lots of people worry about.
And I think that's really important because when there's worry, lots of news gets spread around and it's not always from good sources, and that can put people off of having it. So, you know, we're looking at all of this and we can confirm that there are not any animal products or fetal cell lines in the vaccines, and they are approved for use. The information we've been given about who should not have the vaccine is basically anybody who's had a serious allergic reaction, so anaphylaxis or an allergic reaction that's required them going to hospital and needing medications, to a previous vaccine or any of the ingredients that are in the vaccine. And if you've had lots of allergic reactions to different medicines or different ingredients, then we'd recommend speaking to your GP and going through that with them first, just to make sure it's safe. But everybody giving the vaccine in the vaccination centres is trained on asking all the right questions about which allergies you may have had, and trained in managing allergic reactions. So that's important as well. We're advising to leave a week between the flu jab and the COVID vaccine at the moment. And if you have had COVID in the last 28 days, they advise that you delay it. And that's just because we know that the symptoms of COVID can sometimes last a bit longer. And we want to make sure that people aren't attributing those symptoms of COVID to the vaccine. You cannot get COVID from the vaccine. It doesn't have the ability to give you COVID. Neither of them do, so it's not a risk in that respect. It aims to prepare your immune system to fight off COVID and to stop you becoming severely unwell should you develop it. So that's just a brief overview about the vaccinations at the moment, and I know there's going to be lots of questions about them, so Katy and I are going to take some questions and try and answer anything you have to ask us now.
Amazing. I'm going to ask you the first question, Kerry, because I've seen it in the chat, and then I'll hand over to Jess and the CDC team. You left off with a bit about how the vaccine works. Just expand a bit more on that, actually, a bit more detail, because I saw something in the chat about how the different vaccine works. And of course, there's this myth that it changes your DNA, or you inject something into your body that's foreign material, and people are really, really worried about this, I think.
Mm-hmm. Yeah, and I can understand that. I think everybody is nervous whenever there's new things coming out, and particularly about your health. I understand why people are worried. So the way that the vaccines work, so the way that any vaccine works, is to try and make your immune system recognize the virus or whatever it is that you're trying to fight off. So the way that these vaccines work is they show your body a little bit of what a coronavirus vaccine looks like, so that your body can see that, recognize it as something that might make them unwell, and make antibodies and make an immune response to it. And that means that next time it comes into that small bit of the virus, it recognizes it straight away and starts to fight it off very quickly. So all the vaccines work like that. They enable your body to remember what that virus might look like, even though it hasn't come into contact with the virus before, and start to fight it off really quickly. The way that the different vaccines work, so the Pfizer vaccine and the Moderna vaccine both work using something called messenger RNA, and that's a way of making your body produce this small segment of protein from the virus, so that the body can then recognize it and fight it off. So it doesn't change your DNA, it doesn't have an effect on your DNA. It just causes your cells to briefly produce a small amount of protein, not the whole virus, but just enough so that your body recognizes that, and when it comes into contact with it on the virus, it can fight it off. The AstraZeneca vaccine works slightly differently. So again, it delivers that small segment of protein, small bit of the virus to your body so that it recognizes it, but rather than using the what we call messenger RNA, it uses a different virus which is inactivated and can't cause any damage. And that delivers the protein to you so that then your body can recognize it and fight it off. Does that make sense?
Yeah, you can unshare screen sharing if you like.
Yeah.
SE team, over to you guys. There's been lots of questions in the chat. Hit us with them.
Yes, an amazing amount of questions, all really important. Shall we kick off with one that I think you spotted in the chat as well, Catty, about can the virus be transmitted by touching food or packaging in the supermarket?
The short answer is yes. Okay, we've got to be hyper vigilant when we go to shopping, because actually shopping is an essential necessity. You can leave the house to go and do that. I would advise anyone who's able to try online shopping, particularly if they're older, or if they have long-term conditions. And actually our social prescribing team have been brilliant and get lots of people up and going with online stuff if they've needed help. So social prescribers are there to help you if you haven't been able to. The worry is obviously when you go shopping, people are touching things, aren't they? If they're not touching it, the kids might be touching it, and you don't know who's touched what when you pick it up. So if you use hands, space that we've talked about, you're not at risk of transmitting it to yourself. But if someone, say, sneezes over something and then you pick it up and it goes into your trolley, it's in your hands. So there is a risk there, but we've taught you we've gone through all the ways that you could reduce that risk for yourself. So in the first instance, if you can, do online shopping. If you can't, and to be honest, a lot of people, like say Kerry and I, we feel that we shouldn't go online shopping because we should save that for people who really need it, like those who are vulnerable. If you can, go at a time that's quieter, go by yourself rather than lots of people, spend as less time as possible, and don't touch things that you don't need to touch. Wash your hands before and after, and use the alcohol gels. When you get home, unpack everything, disinfectant, wipe everything, let it dry before putting it away, and wash your hands again.
Thanks, Catty. Another question that came up in emails beforehand today was around pregnancy and conceiving. Can the vaccine stop people from conceiving? And is it safe for people who are trying to get pregnant or who are pregnant?
Yeah. So there's no evidence that the vaccine can cause any problems with fertility. We're not asking people to avoid pregnancy after having the vaccine. And there's no evidence that it causes any problems during pregnancy either. But with every medicine and every vaccine, before we recommend for it to be used in pregnancy, more tests have to be carried out. So at the moment, it's not routinely being offered to pregnant women. However, if the pregnant woman has an underlying health condition that puts her at a higher risk of developing severe disease from COVID, some pregnant women are then being offered the vaccine because the risk of COVID may be seen as greater. So it shouldn't stop you trying to get pregnant. It shouldn't have any effect on your fertility. But if you are pregnant, you probably would be asked to delay the vaccine unless you have an underlying healthcare condition.
Thanks, Kerry. Another question. Well, there's a few questions that have come up in the chat, that are regarding the news that we've seen about people from Black and minority ethnic backgrounds, like perhaps suffering more from the virus and their kind of death rate. I wonder, I've seen that there's also somebody on online from public health. Is it Amibola Junaid who might be working on that as well? If anybody wants to say something about that.
We know that there's a few things actually. So Black and ethnic minorities are affected more by coronavirus. They're more at risk of going into hospital and higher risk of death. Okay. We also know that surveys are showing that compared to English communities, the Black, Asian and ethnic minorities other ethnic minorities are less likely to accept the vaccination. So there's a real hesitancy there, which I think will also have an impact on the severity of coronavirus for that group of people. And this is a real worry because actually we have a vaccine that works. We know from giving it now, the NHS has given it to, I think, over 6 million people in the country already. We know that what it has done is, even if you get coronavirus, after the first dose, it reduces your risk of actually going into hospital and having a severe disease. So there is this really poisonous combination of a group of people who are already more at risk and also less likely to get the treatment that we know is available and that works for it. And this is part of the reason we're here actually, that we need to make sure that information is getting to these groups that's reliable, that's accurate, that's not scaring them about this. And just like coronavirus is spreading, there's this other spread of false information, which is causing a real catastrophe. So my plea to everyone out who is listening to us today is, please look at your WhatsApp messages with a bit of caution. There's lots of scaremongering and false information in there. Do not forward stuff on to other people unless you can verify its accuracy in some way as well, and think about the kind of messages that are being shared. Now, the thing that happened in Norway recently, that was in the papers and in the news, about people dying in care homes after COVID vaccination, that went around WhatsApp like, faster than coronavirus is spreading at the moment, and people are really worried about it. But actually, when you look at the whole context, these are people in care homes who are already elderly, who are vulnerable, have lots of underlying long-term problems. Outside of coronavirus, when you look at care homes, about 45 people die daily in care homes across the country. And these 33 deaths in care homes after coronavirus vaccinations were made to sound like it was the vaccination that caused it. Whereas actually, when you look at the bigger picture, these were already ill patients, and it happened to be a coincidence that they had coronavirus. And actually, if that care home gets a coronavirus outbreak, we know that the outcome is absolutely catastrophic. And we've seen that in care homes here as well. So it's really, really important that we protect our BAME communities, specifically around now.
Hello, everyone. Can you hear me?
Yes.
Okay, thank you. My name is Abimbola Junaid. I'm from the Tower Hamlets Council of Voluntary Services, not the Public Health. So the BAME's Disparities Project is mainly to help to coordinate a community of practice and, of course, being able to disseminate this information accurately to the participants, and then they are able to cascade that to their service users. That's the whole point of this project. And as a matter of fact, we had a BAME network event just yesterday. This time yesterday, you wouldn't have had me on this call. But it was a really good participation, and of course, the vaccine hesitancy was noticed. And what we've been able to do on our part was to be able to gather positive comms materials of community leaders from the BAME community, of faith groups, which we will then share with our partners to allay those fears and also to get the information. And part of why I'm also here is to get that information that we can cascade. So I'm open to working more with this partnership and any other persons as well. And if you do know any BAME organization, please let them know we exist. Thank you.
Thank you, Abimbola. Abimbola, would you be able to share your email address for people? Oh, there it is. So if you are a community leader or you're connected to some other organization and want to be part of this network that is talking about BAME disparities in the borough, do.
Yeah, and can I just quickly say one thing about the program, the Disparities Project really came about as a result of the Race Commission's findings in Tower Hamlets. So, and also the disparity issues that, you know, the COVID-19 has brought up. So the idea is that we would have a community of practice to implement some of the strategies and findings from this, as well as making it a community-based thing, with BAME community being the ones driving it. So it's new, and we are definitely still looking forward to people joining that. And I think it's an opportunity to be maximized. Thank you.
I have a question from the amazingly generous Catty around time. Is if people want to and are able to, are people keen to stay on this call for a little bit longer? Can you give me a thumbs up if your videos are on? Yeah, brilliant.
You'll have to ask Kerry separately. Poor Kerry's in clinic at the moment.
Yes, Kerry, yeah, if you do
stay for a bit longer.
Amazing, thank you. Okay, so back to the questions, if we could get a couple more answered. There's one question which is about, when will local GP surgeries be offering the vaccine? The concern is that elderly people aren't able to travel to sites because of accessibility.
Yeah, brilliant question. Very, very, very soon. In fact, we received a supply of vaccinations yesterday at most of the practices actually in Tower Hamlets for our housebound patients. So these are patients that we know can't leave the house, and we often need to do home visits to look after them. So our teams will be coming out to them to vaccinate them sort of almost in the next few days. We started yesterday. And if you can't travel to vaccination centres for whatever reason, it's worth emailing your practice and asking them to keep a note of the fact that you can't travel, so that if we get more made available after we've done the housebound patients, or if you're someone already at high risk, then we can also put you on our priority list. Thank you.
Another question that we're hearing is about concern about what's happening in the hospitals, and I'm picking up on a question that says, are COVID and non-COVID patients being put in the same wards?
So what I'm hearing from my hospital colleagues is that that's not the case, as far as I'm aware. There are what they're defining as sort of red zones. I think even in A&E, if you attend A&E, you'll be triaged as to whether you have COVID symptoms or non-COVID symptoms, and those with COVID symptoms are cared for and assessed in a certain area, with those with non-COVID symptoms are in a different area. So we are keeping separately people with COVID and without COVID, because we know that if you're already in hospital and unwell and you don't have COVID, you don't want to pick that up from somebody that has COVID. And the other thing to mention is that all the staff will be wearing PPE. They are all very trained in sort of decontaminating after being in contact with COVID cases. So they're really minimising your risk of picking up COVID in hospital. And I know there is a big concern with patients that I speak to are very afraid to go to hospital at the moment. And it's just to say that we wouldn't advise you to go to hospital unless we think that you are very unwell and need to go. And in those situations, I think it's really important that you do attend. As we said before, if you've got very severe shortness of breath, chest pain, something that means you're very severely unwell, even if it's not COVID related, if you're unwell from something else, you need to be attending hospital to get the right treatment to look after yourself. We don't want to see people avoiding hospitals and becoming more unwell in the community.
Thanks, Kerry, for clarifying that. One question is about, so Catty, you mentioned that there's lots of information going around on WhatsApp and we don't really know who's written it or where it's come from. But where do you think is a good place to get trusted information about the vaccine?
So the media has been quite good, actually. So think about if you're good with going online, then the government websites are the safest bet in terms of where you get information from. BBC online as well as on TV has been brilliant at not only giving good balanced information in the way that isn't that scientific that, you know, my mum would be able to understand, but also in different languages as well. So BBC is a really good good resource, and actually lots of local newspapers, particularly around the vaccines, are producing sort of frequently asked question sections in different languages as well. So I don't think WhatsApp is WhatsApp or Facebook or those sorts of places are the best at the moment. It's unfiltered information. No one has verified it. You don't know where it's come from, but these sorts of places are great. And of course, you know, if you have family members who are part of the health organization, whether they're pharmacists or nurses, or you have friends and family who are in the medical arena, it's worth asking them as well. And obviously your local pharmacists, and when you interact with us in any way, we'll be happy to help, but please look for a reliable source like that.
Great. And we've had a question around what sort of side effects, what are the side effects of the vaccine?
So the most common side effect from having the vaccine, like most vaccines, is having a bit of a sore arm for a day or so afterwards. Some people can experience sort of mild temperature rises, mild aching, but they're generally quite brief and they last for a day or so and then settle down. There haven't been any significant side effects that we're warning people to look out for, other than the normal things we would say after a vaccine. I've had my vaccine and I just had a bit of an achy arm the next day and otherwise felt fine. Obviously everybody is very different, but there are no sort of specific worrying side effects that we're warning people about, other than the usual achy arm and a little bit of muscle ache and maybe a mild fever.
Brilliant.
I've had my vaccine as well. Unfortunately, someone didn't turn up for their vaccine appointment. So we had the vaccines are we don't want to waste them. So there's messages that go around just basically asking people last minute to come in if they haven't had it. And similarly, when I had my vaccine, I went in between my clinic and then came back and just carried on working. And again, had a very mild sore arm, which was absolutely fine.
I think maybe we'll call this the last question. So we've talked about how there's two different types of vaccinations, and Catty, you answered in the chat a question around what if you get one at the beginning, will you get the same one for the follow-up? This question is about the duration in between the vaccines, because I think there's some concern. Originally it was going to be a shorter gap and now it's a bit of a bigger gap. I wonder if you could talk a bit about that.
I can start, Kerry, you might fill things in as well. So the vaccination programme has, the information evolves quite a lot. When we went and had our vaccinations, the way it works is you will get an invitation, either a letter or a text message to say, here's your link, please book yourself an appointment. You go at the time of your appointment to the vaccination centre, they'll ask you for your NHS number if you have it, book you in, they'll take a whole history from you around your medical conditions, any allergies. They've all had training to make sure they tell you if you can't have the vaccination, and there's such few people that can't. And these will be ones that have had very, very, very severe anaphylaxis reactions to certain things. And carry an EpiPen. And even then, if you are one of those patients, they'll be able to advise you where and how you can have your vaccination and which one. When you go to the vaccination site, You don't get a choice of which vaccination is offered to you. It's basically what's available and what the government have supplied us with. Once you have the vaccination after they've done a thorough inquiry, you sit and you're observed with the Pfizer vaccine for about 15-20 minutes in case there is any reaction. And if there is any reaction, it should happen pretty immediately. And there are medical people on site to help you with that. Now, the issue is between is around public health, right? The government have said that in order to get through this pandemic and go back to some sort of normality, we need to vaccinate as many people as quickly as possible. We know from the scientific data and the research that even after one dose of the vaccine, you get about something like 60, 70, 80% protection from coronavirus. It's only after the booster dose that you're seeing 9% protection. So it is really important to have both doses, but even after one dose, you have some protection. So the government, based on information and advice from their medical advisors, have said to us that it's better that more people are vaccinated with just one vaccine rather than a smaller group having two vaccines, having both their doses. So if you're in a house with 3 other people, they feel it's better that all 3 of them have had one dose rather than one people having both doses and the other 2 being left unvaccinated. Now, there are various things that influence this, and we might see this advice even change going forwards. So don't be put off by the changes. This is quite normal in this sort of situation, and as the information arises, we just follow the guidelines and the protocols, and we'll give people vaccinations based on this. So so don't be worried about the fact that it has changed. The vaccination is still working. And some people have said, if I've had COVID, do I still need the vaccination? It's I've immunity now. Actually, having COVID doesn't give you as much immunity as having the vaccination. And in general practice now, Kerry and I are seeing people getting COVID for the 2nd time. So it's really important that people do get the vaccinations, because 1 in 10 people who get COVID will have coronavirus symptoms that last beyond just a few weeks. They will last 3 months, 4 months, 6 months and longer, because what coronavirus does is in some people, it causes permanent damage to the bubbles inside your lungs, the bits that are inside your lungs that expand and shrink when you breathe. So when that becomes scarred by coronavirus, you suddenly can't do that expansion and shrinking so people are left with tiredness and breathlessness. And we think that actually there's going to be the next big problem is going to be all these people who've had coronavirus, who have now got this long COVID syndrome because of some of the permanent damage left over. So the only way to prevent that from happening is not getting coronavirus and doing the hands, face space we talked about. And the only treatment at the moment is the vaccine, which means that if you do get coronavirus, it will be much less severe. You're much less likely to end up in hospital. There's much fewer chances of death.
Thank you so much.
Kerry, I don't know if you want to add anything to that.
No, I think just to say, so the the AstraZeneca vaccine, I think, was always tested with 1 dose and then 12 weeks later a 2nd dose, and that has not changed. I think the concern is around the Pfizer was first given with a repeat dose at 3 weeks, and that's now been extended. And I think Katty's explained the rationale behind that around getting more people to have their first dose so that we can protect as many people as possible. And on top of that, we all just need to be following the guidance around staying at home and trying to avoid transmission until we can get enough people vaccinated and the cases come down.
Brilliant. Well, I'd just like to say a massive thank you to Katty and Kerry. And hopefully, this isn't the end of the conversation. The Bromley by Bow Centre and Bromley by Bow Health are looking and hoping to do more sessions like this to answer more questions in the future. If you didn't get your question asked today, do keep in touch. I'm just going to share my screen to no, that didn't work this time again, sorry. So yeah, I'll put it in the chat box. Just send an email to communities driving change at Bromley by bbbc.org.uk. I wonder if we can try this polling thing again. I'm really sorry, I am a bit of a rookie at Zoom still. So I'm going to put up these questions and yeah, let's just see how this goes.
Whilst Jess starts the polling thing, just one last message from Kerry and I. The vaccine is safe. The vaccine there is nothing untoward in the vaccine that should impact anyone's religious beliefs or dietary beliefs or dietary needs. There is nothing in the vaccine that's going to cause long-term fertility problems. There's nothing in the vaccine that changes your DNA or any part of your body for that matter. What the vaccine does is it creates an army inside your body to fight coronavirus. Those with long-term conditions like diabetes, blood pressure, kidney problems, any genetic conditions, all of these people are more at risk from coronavirus than anything else like the vaccine. So these people should definitely be going to get the vaccine. And if you can help spread that message, not only are you providing safety for the people that get the vaccine, but the more people that get the vaccine, the safer you are as an individual, because suddenly coronavirus stops spreading in our community. So please, 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 from both of us, pass that message on to everybody that you speak to today.